All right, you guys, thank you so much for hanging in there with me again. Sorry for the technical difficulties, but we have that ironed out now. So this evening we will be going over communicable diseases, and here's our next slide. So understanding communicable diseases. A communicable disease is also known as an infection or a contagious disease, and they are illnesses caused by bacteria, viruses, fungi, or parasites that can be spread from one person to another. These diseases can be transmitted through direct contact, airborne droplets, contaminated surfaces, bodily fluids, or even insect bites. Hello, Tina and Stacey's. So for CNAs and PCTs, understanding communicable diseases is essential to keeping yourself, your patients, and your coworkers safe. You are often the first line of defense in preventing the spread of infection by recognizing early signs of illness, practicing proper hand hygiene, and using PPE, which is personal protective equipment, and following isolation precautions. You play a critical role in infection control and patient care. Tana says she doesn't hear me. Can everybody hear me? Let me get in the chat really quick. Okay. All right. As long as you guys can hear me. If you guys aren't unable to hear me, be sure that your volume is up on your computer. But I have people saying that they can hear me, so thank you. Thank you for them. All right. On to the next one. So we are going to do the practice test over communicable diseases. So whether it's influenza, C. diff, or MRSA, which you guys may hear someone pronounce as MRSA, knowing how these diseases spread and what to do when symptoms appear can literally save lives. So let's test your knowledge and strengthen your skills. For the test instructions, we're going to choose the best answer for each question. Each question is multiple choice. Don't forget to like, share, and subscribe, and good luck. So question number 1, which organ is primarily affected by tuberculosis, also known as TB? Give you guys a few seconds here to answer that. Starting to see answers in the chat. All right, the chat is filling up. There we go. I'm seeing some recurrent viewers. Thank you guys for that. All right, here we go in 3, 2, and 1. The correct answer is A, the lungs. So tuberculosis is a communicable disease that primarily affects the lungs. CNAs must assist with airborne precautions and ensure that the patient wears a mask when a patient has TB. All right, let's see. And they should be wearing the mask during transportation. So if you're taking them to and from areas, be sure that they have a mask on because it is spread by airborne. So the takeaway for this one, I myself as a nurse and when I was a CNA, I have this question. They want to know, how is TB spread? TB is airborne. All right, question number 2. Which of the following is a sign of influenza? A, swollen joints, B, constipation, C, fever and cough, or D, skin rash? Give you guys a few seconds to answer that one. All right, here we go in 3, 2, and 1. Lots of C's. Correct answer is C. You guys are so smart and you're doing so great. Thank you for that. So it's fever and cough. Influenza often causes fever, cough, body aches, and fatigue. So CNAs monitor vitals and promote hydration and rest. All right, question number 3. What type of precaution is used for a patient with C. difficile? And you guys may hear this pronounced as C. diff. What precaution should we use for a patient with C. diff? A is airborne, B is droplet, C is standard, or D, contact precautions? All right. We'll go ahead and reveal that answer here. Starting to see more replies. The correct answer is D, contact. So Clostridium difficile is transmitted through direct or indirect contact. Gown and gloves are required when providing care. So one quick thing about C. diff, sometimes people have very explosive diarrhea with it. It may not be explosive, but they have a volatile diarrhea. So with C. diff, it's a spore, and you cannot use hand sanitizer when you have a patient who has C. diff, because just like a M&M, it has that hard shell on there. You put the hand sanitizer on there, you rubbing it through your hands, you're just coating that shell just like you would on an M&M if you put something on, another layer onto it. So you need to use that friction and be sure that you're washing your hands very well. And that's it. All right, question number 4. Which communicable disease causes yellowing of the skin and the eyes? Option A is hepatitis B. Option B is pneumonia. Option C is tuberculosis. D, meningitis. Seeing a lot of A's here. All right, here we go in 3, 2, and 1. The correct answer is A, hepatitis B. So hepatitis B affects the liver, leading to jaundice properly, and wear gloves during personal care. So correct answer is A. Question 5. Which symptom is most associated with meningitis? A, sore throat. B, stiff neck. C, diarrhea. Or D, cough. Okay. Reveal the answer in 3, 2, and 1. B, stiff neck. Meningitis causes inflammation of the brain and the spinal cord lining. Early symptoms include stiff neck, headache, and fever. Question 6. How is chickenpox primarily spread? A, through the urine. B, through blood. C, through sexual contact. Or D, through airborne droplets. All right, here we go. The correct answer is D, through airborne droplets. So chickenpox spread via coughing and sneezing. So CNAs must use airborne and contact precautions when a patient has chickenpox. So be sure that you're encouraging your patient to use cough hygiene. So what that is, like if you're coughing, you sneeze into cough or sneeze that you're sneezing into the elbow, that you're covering your cough with the tissue, and you're washing your hands afterwards so that we can decrease the spread of infection there. All right, question 7. A CNA is caring for a patient with scabies. What PPE is required? A, gloves only. B, gown only. C, gown and gloves. Or D, mask and gloves. So we're learning about these diseases today. All right, here we go in 3, 2, and 1. The correct answer is C, gloves and gown. So scabies is transmitted through close contact. Wearing gown and gloves helps prevent the spread. Question number 8. A resident has MRSA or MRSA in an open wound. What is the primary concern for the CNA? A, contact transmission. B, airflow. C, nutrition. Or D, eye protection. Here we got a few more seconds to answer this. All right, here we go in 3, 2, and 1. The correct answer is A, contact transmission. So MRSA, which stands for methicillin-resistant Staphylococcus aureus. So what that word means is that this organism is resistant to methicillin antibiotics. So it can only be treated by use of certain treatment because it's already resistant to a certain kind. So it's caused by staph bacteria that has become resistant to many common antibiotics and is spread through direct contact with infected skin or contaminated surfaces. So CNAs should follow contact precautions strictly. So just so you guys know, in the community, you may see MRSA easily spread in the gym. That's another place. So be sure that you guys are using your good hygiene and, washing your hands after leaving the gym if you work out. All right, question number 9. A CNA notices that a resident has high fever, runny nose, red eyes, and a red rash that started on the face and now spreading down the body. Based on these symptoms, which communicable disease should the CNA suspect? A, eczema, B, cellulitis, C, measles, or D, influenza? All right, here we go. In 5, 4, 3, 2, and 1. The correct answer is C, measles. Measles is a highly contagious viral disease that begins with a high fever, cough, runny nose, and red eyes, followed by a red blotchy rash that typically starts down the face and spreads downward. Okay. Number 10, what is the most effective way to prevent the spread of communicable diseases? A, wearing goggles. B, using hand sanitizer occasionally. C, frequent hand washing. Or D, isolating all residents. Quick answers there. Good job, you guys. Good job. All right, here we go. 3, 2, and 1. Correct answer is C. Everybody got that correct, so great job there. Frequent hand washing. Hand washing is the single most effective infection control measure for CNA. So whenever we want to try to prevent the spread of infection, we're going to wash our hands because we know we touch so many surfaces. We use our hands when we're coming in contact with our patients. So let's say that Mrs. Jones in room A has, let's say she has C. diff, and I just go to the next room without washing my hands well. Then I go see Mr. Brown in room B, and I touch him. So now I spreaded the infection whenever the infection should have been stopped at the source for me washing my hands. So be sure that you guys are washing your hands very well to prevent the spread of disease. Question 11. Which disease is commonly spread by sharing needles? A, hepatitis B, B, influenza, C, pneumonia, or D, C. difficile? So we're talking about sharing needles. Remember, we're going to break the question down. We need to know what the question is asking, and we need to pick our best answer. All right, here we go. In 3, 2, and 1. The correct answer is A, hepatitis B. Hepatitis B is a blood-borne virus often transmitted via shared needles or contaminated instruments. Good job there, you guys. All right, question number 12. A patient with active TB needs to be placed in which type of room? A, a private room with open windows. B, a negative pressure isolation room. C, a room with positive airflow. Or D, a shared room with a curtain divider? All right, here we go in 3, 2, and 1. Correct answer is B. Good job, you guys. Negative pressure isolation room. So a negative pressure room works by using a ventilation system that pulls air into the room but does not allow it to escape into the surrounding areas or common areas. Instead, the contaminated air is filtered and exhausted safely outside the building. So if you have a patient with tuberculosis, main thing, negative pressure isolation room. So what the rationale is saying that it's pulling the air out, and instead of spreading it all throughout the facility, it's going directly outside of the building. So it's not contaminating others by the air just flowing inside the building there. Great job there. All right, question 13. Why are elderly patients more susceptible to communicable diseases? A, they're more likely to travel internationally. B, they don't like to wash their hands. C, they receive too many vaccinations. Or D, their immune systems are often weaker due to age and chronic conditions. You guys are answering this one pretty quick. Good job there. All right, here we go in 3, 2, and 1. Their immune systems are often weaker due to age and chronic conditions. Correct answer was D. Great job there. So as people age, their immune response slows down, making it harder for their bodies to fight off infections. Chronic illnesses like diabetes, COPD, and heart disease further weaken their ability to recover from communicable diseases. Close living quarters and long-term care settings also increase exposure risks. All right, which PPE should a CNA wear when caring for a patient with suspected COVID-19? A, gloves, gown, N95 and face shield. B, glove and mask. C, gloves only. Or D, no PPE needed. So think about COVID. I'm not sure if it's went down quite a bit in your region, but I know it's back on the rise in mine. I live in Illinois, and it's starting to come back again. All right, here we go in 3, 2, and 1. Correct answer is A, gloves, gown, N95, and a face shield. So the rationale, full PPE is required for COVID-19 due to droplet and aerosol transmission. That's right, Miss Benita, it never left. It did not leave at all. I wish it would, but no, it did not. Which of the following is one of the most common communicable diseases among elderly adults in long-term care facilities? A, measles. B, norovirus. C, malaria. Or D, ringworm. This is a tough one, huh? I'm not seeing many answers in the chat here yet. I'll give you guys a few more seconds. Have varied answers, but even if you guys don't know the correct answer, remember it's better to guess the answer than to leave it blank. So take your best guess at this. All right, here we go in 3, 2, and 1. B, the correct answer is norovirus. Norovirus is a highly contagious virus that causes vomiting and diarrhea. It spreads rapidly in communal environments like nursing homes and assisted living facilities. Question 16. Which disease is most likely to cause watery diarrhea and abdominal cramping? A, MRSA. B, COVID-19. C, hepatitis C. Or D, C. difficile. All right, here we go in 3, 2, and 1. C. difficile. C. diff or Clostridium difficile is a common and serious infection in healthcare settings especially after a resident takes antibiotics. Antibiotics can wipe out good bacteria in the gut, allowing C. diff to grow and cause watery diarrhea, fever, and dehydration. C. diff spreads through spores in the stool, which can live on surfaces like toilets, bed rails, and wheelchairs. These spores are tough and not killed by hand sanitizer. So remember to wash your hands whenever you're doing your hand hygiene. Do not use hand sanitizer with C. diff. Someone in the comments asks how to become a PCT from a CNA. I know in Illinois for us, you just go and you apply for it, but you have to have a certain skills checklist. So there's a certain training to do with that, but you can be a CNA and then you do the training and then you become a PCT. And most of ours work in the ER where I'm located at. All right, here we go. Question 17. Which of the following is a fungal infection that can spread between patients? A, influenza, B, ringworm, C, pneumonia, or D, hepatitis? All right, here we go in 3, 2, and B, ringworm. Ringworm is a contagious skin infection caused by fungi and spreads via contact. Question 18. A CNA has just finished providing care for a resident diagnosed with C. difficile. What is the correct hand hygiene procedure the CNA should follow before leaving the room? Remove gloves and use hand sanitizer. B, remove gloves and wash hands with soap and water. C, wipe hands with an alcohol pad. Or D, put on clean gloves and continue to the next room. You guys also in the comments, just making sure you guys all seen that one, that we have online training courses for PCTs. You can visit www.floridacareeracademy.com to speak with an advisor. So there are plenty of options here. And are these questions for CNAs and PCTs? There's for both of them, Tina. All right, here we go in 3, 2, and 1. Remove gloves and wash hands with soap and water. So C. diff spores are not killed by alcohol-based hand sanitizers. The only effective way to remove them is wash your hands thoroughly with soap and warm water. CNAs must first remove gloves properly, then wash hands immediately to prevent the spread of infection to themselves or other residents. So remember, you guys, soap and water with C. diff, and make sure you're using the friction because the friction is what's going to get the bacteria off your hands. All right, question 19. A resident has been placed on contact precautions due to a communicable infection. Which supplies should be readily available outside or just inside the room to protect staff and prevent the spread of infection? A, gloves, gown, hand sanitizer, and disposable wipes. B, gloves, gown, N95, and a face shield. C, an isolation cart, oxygen tank, and call bell. D, surgical mask, thermometer, and tissues. So they're on contact precautions. What are we using? Someone in the comments says, can you tell me again? I need a certificate. If you scroll up a little bit in the comments there from Nurse Eunice, you can see the website to go to gain that certificate. Let me know if you cannot locate it because I can copy and paste it and put it back in there for you. Let's see. There it is. All right, you all. Here we go with the correct answer in 3, 2, and 1. The correct answer is A, gown, gloves, hand sanitizer, and disposable wipes. For contact precautions, gown and gloves must be worn when entering the room and removed before exit. A hand hygiene station with soap and water or sanitizer, depending on the infection, should be accessible. Disposable wipes for cleaning equipment and surfaces are also essential. An isolation supply cart with these items should be placed just outside or inside the room for easy access. There you go. And then also in the comments there is the website. So it's Florida Career, www.floridacareeracademy.com. And that's nationwide PCT classes. So if you guys are interested, be sure to go check that out. Even if you have other questions about the programs that are offered at Florida Career Academy, be sure that you guys go check out the website and definitely tell your friends about it as well. All right, here we go. Question 20. If a resident with shingles, also known as herpes zoster, needs to be transported, what should the CNA do? A, place a mask on the resident. B, use contact precautions only. C, keep the resident uncovered. Or D, transport without any PPE. Let's see. Does anyone, I can get a good website of videos, promotion and safety of health. Brayna, be sure to look at the YouTube site for Florida training. There's a lot of videos on there from Nurse Eunice. Be sure to look through those. Someone's in New York. Hello, New York. All right, let's reveal the answer in 3, 2, and 1. The correct answer is A, place a mask on the resident. Shingles is caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox. Although shingles is spread through direct contact with fluid from the rash in immunocompromised patients or when lesions are widespread, airborne transmissions is also a concern. Placing a surgical mask on the resident during transport helps reduce the risk of spreading the virus, especially in shared areas. Is this video saved? Jackie, you can refer back to this video by logging on to YouTube and going to the Florida training site. If you select live, it will be under the stored live videos. Thank you for attending. All right, question 21. A CNA is caring for a resident with shingles. What is the correct precaution to take? A, droplet precautions only. B, airborne precautions only. C, standard precautions only. Or D, airborne and contact precautions. So the resident has shingles. What precautions are we taking? All right, here we go in 5, 4, 3, 2, and 1. The correct answer is D, airborne and contact precautions. I see a lot of correct answers in the chat, so great job for that. Shingles, especially when open lesions are present, can be transmitted via airborne and contact routes. Also, you guys, you may hear your patient say, I am hurting so bad, these shingles really hurt. People have very high pain whenever the shingles are present. And you know, pain is subjective. So if a patient says that they're having excruciating pain, you always want to report that to the nurse. Even if they're saying that they have minimal pain, that's something that you guys want to report to the nurse. But as a CNA, you know, there's some things that you may be able to do, but be sure to report that to the nurse too. Hi, Mila. Thank you for coming back on. I know you were with me earlier, but I had that technical difficulty, so sorry about that, and thanks for rejoining. All right, question 22. Which communicable disease is caused by a parasite and leads to intense itching? A, scabies, B, ringworm, C, MRSA, or D, influenza? Here we go in 3, 2. Give you guys just a little bit more time. I'm not seeing many answers in the chat. Milo, we're learning about communicable diseases today. All right, here we go. M1. The correct answer is scabies. Scabies is caused by mites and spreads easily through physical contact, requiring treatment and environmental cleaning. Question 23. Is HIV, the human immunodeficiency virus, considered a communicable disease? A, no, because it cannot be spread from one person to another. B, yes, because it spreads through direct contact with infected blood or bodily fluids. C, no, because it only affects the immune system. Or D, yes, because it spreads through airborne droplets like the flu. Hello from Canada. Thank you for joining us. Give you guys a few seconds to answer that one. Here we go in 3, 2, and 1. Correct answer here is B, yes, because it spreads through direct contact with infected blood or bodily fluids. So HIV is a communicable disease that because it can be transmitted, from one person to another, primarily through blood, semen, vaginal fluids, breast milk, and from mother to baby during childbirth or breastfeeding. It is not spread through casual contact, coughing, sneezing, or sharing food. CNAs must follow standard precautions, including glove use and safe handling of sharps or bodily fluids to prevent exposure. What are symptoms of HIV? That might have sores that won't heal. One thing that they can do is they can draw labs to see if the person is infected with that, and they look at this total count. And then some other things, they might continue to get sick. Some people have different symptoms, but those are just a couple right off the top. But it's a very serious illness. And one thing about it is I always want to make sure people don't treat people different based off of an illness, because nobody woke up this morning and said, I want to have HIV today. So make sure that you guys are still treating any patient with any diagnosis with the same compassion that you would want them to treat you with if you were the patient. All right, here we go. Question 24. Which vaccine helps prevent the spread of communicable liver disease? A, influenza vaccine. B, pneumonia vaccine. C, tetanus vaccine. Or D, hepatitis B vaccine. All right. Give you guys a few more seconds here. Here we go in 3, 2, and 1. The correct answer is D, hepatitis B vaccine. So as a rationale, hepatitis B vaccine protects against the virus that attacks the liver. 25. Why must CNAs report suspected cases of communicable diseases to the nurse? A, to receive a reward. B, to scare other staff. C, it's a part of their legal duties. Or D, to reduce overtime. Here we go in 3, 2, 1. A, it's a part of their legal duties. So CNAs are legally and ethically required to report any signs or symptoms of possible communicable diseases to the nurse immediately. Early reporting helps ensure proper infection control measures are taken to protect other residents, staff, and visitors. Failing to report may lead to outbreaks, serious illness, or even death in vulnerable populations. 26. Which of the following diseases is considered droplet transmitted? A, hepatitis C. B, COVID-19. C, MRSA. Or D, ringworm. All right, here we go in 3, 2, and B, COVID-19. COVID-19 is primarily spread through droplets requiring mask use and distancing. So you guys know about the social distancing as well as making sure that we're maintaining the proper precautions because we know this it can be easily spread. Question 27. A resident with a very weak immune system is placed on reverse isolation. What is the main reason for this type of precaution? A, to isolate the resident for behavioral issues. B, to prevent the resident from spreading infection to the staff. C, to make it easier to clean the resident's room. Or D, to protect the resident from being exposed to communicable diseases carried by others. So let's think about this. We're talking about reverse isolation. And yes, I'm also glad that COVID isn't as bad as it was initially. So reverse isolation, what are we thinking here? This is a tough one, you guys, but again, use your best judgment and select your answer and stick to it. Here we go in 3, 2, and 1. So the correct answer is D. Great job. To protect the resident from being exposed to communicable diseases carried by others. So reverse isolation is also called protective isolation. It's used to shield patients with weak immune systems from germs that others might bring in. These residents are most likely to get very sick, even from a common cold or minor infections. CNAs must follow strict hygiene and PPE rules to protect the resident from exposure. I know I've worked with a few patients who I've had to do reverse isolation with. And just so you guys can kind of pull everything together, the patient that I was working with was a cancer patient. So you guys know that they're immunocompromised. So I was trying to protect them. So I had my PPE on because I was trying to protect them from catching any illness that I could spread to them. All right, here we go. Question 28. Which of the following is a CNA's role in outbreak prevention? A, diagnosing illness. B, administering vaccines. C, following standard precautions. Or D, observing the other staff to see if they are following protocols. D made me smile. So what is the CNA's role in outbreak prevention? So this question is a scope of practice question. So what is within a CNA scope? That's what you guys should be thinking about when you're answering this question that they can do to help prevent outbreaks. All right, here we go in 3, 2, and 1. The correct answer is C, following standard precautions. So CNAs prevent disease by practicing good hygiene and PPE use. Someone asks, what is the best CNA school in New York? I'm sorry, I'm not sure about that one. You would have to check maybe some websites and things, but I don't know much about New York. I'm sorry about that, but you can always check and just type it into Google and see what comes up, or maybe ask a friend for a referral if they've been through a CNA program, or a family member. Or you could talk to a nurse and see if they've went to a certain CNA program. Do we have to wear scrubs during the CNA test? No, you don't have to wear scrubs. In Illinois, you don't have to wear scrubs during the CNA test. Let's see. Okay, here we go to the next question. You just have to, be properly dressed. But even during my NCLEX exam, I didn't have to wear any scrubs. Review the New York Board of Nursing website and review the passing rate. Yes, thank you, Nurse Eunice, for that. So you guys who was asking about the best school, so review the New York Board of Nursing website and review the passing rate. So any state that you live in, they have the Board of Nursing website, and then you can look to see which one has the highest pass rate. That's the one that you would want to go to. In New York, you guys have to wear scrubs, and in Florida, you guys have to wear scrubs. Oh, I'm sorry, I did not know that. Well, for state specific. Yep, please look at your candidate bulletin to view uniform requirements. I'm sorry, you all. Thank you, Nurse Eunice. I did not know that, so I'm learning something new. But yes, please review your candidate bulletin to view uniform requirements there. Thank you so much. And again, I apologize for misinformation. All right, here we go. Question 29. How should dirty linens be handled from a resident with a communicable skin condition? A, shake them before placing them in the bin. B, hug them tight to your chest. C, handle gently and place in designated linen bag. Or D, place them in the resident's closet. What do we think here? Here we go in 3, 2, and 1. The correct answer is C. Handle gently and place them in the designated linen bag. Shaking can aerosolize pathogens, and linens must be handled carefully. So then you guys be sure, if you have these questions or the answers that Nurse Eunice is helping me out with here in the chat, be sure that you guys jot this down, because this is very helpful information that you can all refer back to at a later time, or you may be able to help someone else with that answer. Question 30. A resident complains of intense itching, especially around the waist and armpits. On inspection, small red bite marks and tiny insects are seen in their clothing seams. What should the CNA suspect? A, scabies, B, ringworm, C, body lice, or D, chickenpox? So lots of itching. Here we go in 3, 2, and 1. The correct answer is C. Great job in the comments section. Body lice. Body lice live and lay eggs in clothing and bedding, not on the skin. They come in contact with the body to feed, often causing severe itching, especially where clothing touches the skin. Waste, such as the waist, armpits, and neck. Unlike head lice, they are often seen in residents with poor hygiene or lack of clean clothing. All right, question 31. A CNA discovers that a resident has body lice. What should the CNA do with the resident's contaminated clothing and bedding? A, shake the items out before placing them in the laundry bin. B, place them in a regular hamper for housekeeping to collect later. C, store them in the closet until the nurse provides instructions. Or D, double bag the items and send them for hot water and high heat drying. Looking in the comment section. Hi, Nala. My daughter's on here watching me, you guys. Thank you for supporting me like everybody else on here. Thank you, guys. And someone else asked, are these questions for all? Yes, these questions are regarding communicable diseases. So, yes, they are very helpful to everyone. All right, here we go in 3, 2, and 1. D, double bag the items and send them for hot water and high heat drying. Contaminated items from a resident with body lice should be carefully handled to prevent the spread of lice to other residents or staff. Double bagging helps contain the insects and eggs, and washing the items in hot water and drying them on high heat kills both lice and their eggs. CNA should avoid shaking the items, which can cause lice or eggs to become airborne. No problem, you guys. Thank you. And also my son's watching. Sorry, I almost left him out. Thank you, guys. All right, here we go. Question 32. Which disease requires the use of bleach for cleaning contaminated surfaces? A, C. difficile. B, COVID-19. C, MRSA or MRSA. Or D, influenza. Samarit says, I like the way you're explaining. Thank you very much. It means a lot to me because I try to just make it to where you guys can understand it, because I want you guys to pass your test and I want you guys to be very successful in your career. All right, here we go in 3, 2, and 1. All right, the correct answer is C. difficile. So C. diff spores are resistant to many cleaners and require bleach-based disinfectants. Someone asked, what's MRSA? So MRSA stands for methicillin-resistant Staphylococcus aureus. So it's a organism that is resistant to certain bacteria, can be very difficult to treat, and it is transmitted through contact precautions. So if you make contact with that organism, then you can spread it. So we want to make sure that we're using our proper PPE when we're working with a patient who has MRSA. All right, here we go. Question 33. A CNA is assisting a resident who has been coughing for several weeks and has recently developed night sweats, weight loss, and fatigue. These symptoms may be a sign of which communicable disease? A, pneumonia, B, tuberculosis or TB, C, influenza, or D, hepatitis B. You guys are doing very good on this. This can be a difficult subject to learn because there's so much to take in, but you guys are doing great. All right, here we go in 3, 2, and 1. Correct answer is B, tuberculosis. TB is a serious airborne communicable disease that primarily affects the lungs. Classic symptoms include a persistent cough lasting more than 3 weeks, night sweats, unexplained weight loss, fatigue, sometimes coughing up blood. CNA should report these symptoms to the nurse immediately and follow airborne precautions if TB is suspected to prevent the spread to others in the facility. Let's see, somebody had a question here in the comments. It says, how many questions are on the CNA exam? Let's see if we have an answer here. I am not for sure about that one. Does anyone know how many questions there are? Let's see. Nurse Eunice said the next phlebotomy certification practice test is Wednesday at 6:30 p.m. And thank you so much for helping with the CNA prep exam videos. Thank you, Nurse Eunice. I know you'll have a good turnout. And also that depends on the state, so thank you for that. Yep, so you guys be sure to check your state board website because it depends on which state you're in. They're saying New York, there's 60 questions. Someone else says 70, so be sure to check your state board of nursing website. All right, here we go. A CNA cared for a resident with lice. The CNA did not wear a gown. What should they do after providing care? Use hand sanitizer only. B, brush their own hair. C, shake out their uniform. Or D, wash hands and change clothes if necessary. All right, here we go in 3, 2, and 1. D, wash hands and change clothes if necessary. Great job there. Lice are easily spread and clothes and bedding must be cleaned thoroughly. All right, question 35. Which disease has a long incubation period and may go unnoticed for years? A, hepatitis A, B, norovirus, C, HIV, and D, C. difficile. Yes, you guys are very helpful with helping each other out. And thank you, because you guys are helping me too. One thing about being in healthcare and just any aspect of life, you always want to be a continuous learner. So every day you're going to be learning things new, and always be open to learn more things. That'll get you pretty far. All right, here we go in 3, 2, and 1. The correct answer is C, HIV. HIV can remain asymptomatic, so what that means is without any symptoms, for years but still be transmitted. So a patient can not have any kind of symptoms and they still can transmit HIV. So be mindful of that. All right, here we go. How long should a CNA scrub their hands when washing with soap and water? A, 10 seconds. B, 15 seconds. C, until the soap runs out. Or D, at least 20 seconds. Give you guys a few seconds to answer this one. Yes, asymptomatic means you have the conditions, but you're not having any symptoms. That is correct. So you have the diagnosis, but you aren't having any symptoms. So it's kind of hard to tell, with the naked eye or that the person's having a certain illness. So they can remain without symptoms with HIV for a while. All right, here we go in 3, 2, and 1. The correct answer is D, at least 20 seconds. So effective hand hygiene requires a minimum of 20 seconds of scrubbing. So whenever you're washing your hands, be sure that you're interlocking your hands like this, going over this way, scrubbing the palm there, scrubbing the palm, going around the thumb there, and then going around your palms, interlocking those there. And one thing that they do say, you can sing the ABCs twice, or you can count to 20, but be sure you're not counting really fast, like 1, 2, 3, 4. That's not a second. Make sure you're taking a full second and you're washing your hands thoroughly. And also be sure to clean under your nails. So when you're washing your hands, I always use my thumb to clean the opposite finger to make sure underneath my nails are very clean. So hand hygiene is great for infection prevention. All right. Question 37. A resident with suspected tuberculosis begins coughing up blood during care. What is the medical term for this symptom? And they have a full playlist of clinical skills video at the Florida Training Academy. You guys, you can't lose by following this page. There are so many different resources there. Be sure to check out the website because we are here to prepare you for success for your future. So let's see. What's the medical term for a resident suspected with TB and they're coughing up blood? A, hematuria. B, hematemesis. Say that 10 times fast. C, hemoptysis. Or D, hemiparesis. Can we do a first aid and CPR quiz next? I do believe I've seen a CPR quiz on there, but we will take all your suggestions into account. And I know Nurse Eunice has a video coming up this week. It's not CNA or it's not first aid or CPR, but if they haven't already covered the content, we will be bringing something to you guys. I know I'll be presenting next Monday at 6:30. All right, here we go in 3, 2, and 1. Correct answer is C, hemoptysis. Hemoptysis is a medical term for coughing up blood from the lungs or airway. It's a classic symptom of pulmonary tuberculosis. Hematuria refers to blood in the urine. Hematemesis is vomiting blood. Hemiparesis is weakness on the side. And recognizing the correct medical terminology helps CNAs communicate clearly with nurses and other healthcare professionals. So remember that prefix heme means blood. So urea, put those together, blood in the urine. Hematemesis, you guys know emesis means to vomit. Hematemesis, vomiting in the blood. Hemiparesis, paresis is weakness, it's on one side, so you're putting those all together. And Nurse Eunice says we have them on our playlist. So CPR, first aid, and managing medical emergencies. Check out the website. Check out the YouTube channel. It's already on there. So you guys just check it out. There's so much content on there and it's great information. So definitely look into it because there are plenty of resources. All right. Question 38. Which item must always be disinfected between patient use? A, soap. B, wheelchair handles. C, linens. Or D, name tags. What do we think here? We're disinfecting between patient use. I see a C here, a B. I don't see many answers in the comment section. I'll give you guys about 5 more seconds to think about this one. So it's want to know in between patient use. So if I'm a patient and Miss Kimberly is a patient, who needs to clean in between there? All right, here we go in 3, 2, and 1. The correct answer is B, wheelchair handles. So high touch surfaces like wheelchair handles are potential infection sources. So, when we're wheeling our CNAs don't wash linens, that's right. We have housekeeping. You guys are already going to be busy. You're going to be doing your best, but we also allow our other entities to help us. We have our nurse, we have our housekeepers, we have our dietary departments. There's so many different departments in the healthcare system. So you guys know we all collaborate, work well with one another to provide the best care possible for our patients. So the wheelchair handles, they're high touch surfaces like wheelchair handles are potential infection sources. So if I'm in a wheelchair and my hands are dirty, I grab the wheelchair to take someone somewhere. Someone else comes behind me, they touch the same surface as me. So we want to make sure that's disinfected because that's an easy source for infection. All right. A family member attempts to enter the room of a resident on contact isolation without putting on gown or gloves. What is the best action for the CNA to take? A, allow the visit to continue, but remind them to wash their hands afterwards. B, immediately escort the family member out of the building. C, politely stop the family member, explain the need to wear PPE before entering. Or D, ignore the situation because visitors are not required to follow precautions. Looks like Priya got a kick out of one of these options here. All right, give you guys a few seconds to answer that one. See a lot of correct comments in the chat. All right, here we go in 3, 2, and 1. C, great job. Politely stopping the family member, explaining the need to wear PPE before entering. Because, like Mila says in the comments, sometimes the family doesn't know that the resident is on contact precautions. So we don't have to be rude or anything about it, but we're going to politely stop them and just say, let them know they should be wearing the appropriate PPE, such as gown and gloves, to prevent the spread of infection. And we want to politely educate the visitor on the importance of these precautions and assist them in putting on proper gear and reporting any non-compliance to the nurse if needed. So, sometimes people have issues putting on a gown. We can help get that tied up for them. And, we also will tell them the location of the PPE. So, hey, this is hanging outside of the door. The gowns are here, the gloves are here, and we're going to put it on this order, so on and so forth, because we also want our visitors to be educated as well. All right, question 40. A resident with a wound infection by MRSA begins showing signs of fever, chills, and low blood pressure. The nurse suspects that the infection has entered the bloodstream. What is the medical term for this condition? A, bacteremia, B, septicemia, C, sepsis, or D, all of the above. All right, here we go in 3, 2, and 1. It's a tough one, isn't it? D, all of the above. So when MRSA enters the bloodstream, it can cause bacteremia, which is the presence of blood. Septicemia is another term to use to describe a bloodstream infection. Sepsis is the body's overwhelming and life-threatening response to infection. And all 3 terms are related, but may be used depending on the stage and severity. So all those things can happen. All right. That was definitely a tough question, and some of you guys answered that correctly. And even if you didn't, thank you for still trying there. You guys are doing very good, and I'm proud of you. Question 41. Why is a resident with norovirus at increased risk for dehydration? A, because norovirus causes excessive sweating. B, because norovirus decreases appetite and energy. C, because norovirus leads to frequent vomiting and diarrhea. Or D, because norovirus increases urination. So why are they at risk for dehydration? All right, here we go in 5, 4, 3, 2, and 1. Yes, it can be very scary. There we go. Correct answer is C. Great job there, you guys. So norovirus leads to frequent vomiting and diarrhea. It's a highly contagious virus that affects the stomach and intestines, causing sudden and severe vomiting and diarrhea. This rapid fluid loss can lead to dehydration, especially in elderly or medically fragile patients. CNA should monitor fluid intake and output closely, encourage sips of fluid, and report signs of dehydration, dry mouth, and low urine output and dizziness to the nurse. Bonus question here, you guys. If someone is having dehydration, which electrolyte do you guys think will be decreased? So, which electrolyte do you think would be lower if the patient's dehydrated? Tough question here, but I'm just seeing if we can pull everything together. Any takers? Let's see, in 5, I'm gonna give you guys about 5 seconds. Put your thinking cap on. We're saying sodium. Sodium could be off. What's another one that can be off? So usually if a patient is dehydrated, their sodium is actually a little bit elevated normally. And that's because the body isn't having enough water. There it is. The body isn't having enough water in there, so it's retaining the sodium in there. But somebody answered and they said potassium. Potassium is the one that I was looking for because, when those electrolytes get off, low potassium can cause a patient to have a cardiac arrhythmia, which could eventually lead to a very serious condition. So be sure that you guys are definitely reporting these things to the nurse. They could be hypovolemic. Yep. So the electrolytes may be all abnormal. Like that patient may be having a difficulty balancing those electrolytes. So yes, just be aware of that. And then, try to put all those things together whenever you're thinking and when you're studying. Take it the next step further and say, oh, what will happen next? What would I do as the CNA? Great job there. All right. Which communicable disease is associated with open sores on the lips or the genitals? A, influenza. B, COVID-19. C, hepatitis A. Or D, herpes simplex virus, also known as HSV. So open sores here on the lips or the genitals. Give you guys a few seconds here. You guys are so smart. Here we go in 3, 2, and 1. D, herpes simplex virus. So herpes simplex virus causes painful sores and it's spread through direct contact. In the photo that we have up right now, that is example of herpes simplex virus 1. So that's a cold sore. So if you or anyone gets cold sores, that can be spread through direct contact. So we want to make sure that we're washing our hands and applying our appropriate PPE. Question 43. What should a CNA do after removing gloves? A, shake hands with the resident. B, wash or sanitize hands. C, eat lunch. Or D, wipe down the glove box. So after you take gloves off, what are you going to do? I'm expecting to see all correct answers in the chat because I know you guys know this. You guys are very smart, very intelligent, very dedicated, and I am seeing all correct answers in the chat. So B, wash or sanitize your hands. Gloves reduce contact, but they do not replace hand hygiene. And what illness are we not going to use hand sanitizer with? I'm looking in the chat for that one. So if a patient has this illness, we are not going to use hand sanitizer. We are going to wash our hands. What is it? I'm looking. We've had like at least four questions about it this evening. There it is. Good job, Alexis. C diff for sure. We are not using hand sanitizer whatsoever. We are going to wash our hands with warm soap and water, washing for at least 20 seconds. All right, here we go. Question 44. Great job, you guys. Who decides what PPE is needed for a communicable disease? A, the nurse or the infection control team. B, the CNA. C, the resident. Or D, housekeeping. So who decides what's needed for PPE for communicable disease? I'll give you guys about 3 more seconds here to end. In 3, 2, and 1. All right. A, the nurse or the infection control team. The healthcare team uses the Center for Disease Control and facility guidelines to decide PPE requirements. So if you guys are wanting some more information, you can also always go to the cdc.gov website, and they talk about contact precautions, airborne precautions, droplet precautions, and they go into detail about all these things. So that's always a good site to refer to as the CDC. Question 45. What is the meaning of the term immunocompromised? A person who is highly contagious. B, a person whose immune system is weakened or not working properly. C, a person who is allergic to antibiotics. Or D, a person who has recovered from a disease. So what does the term immunocompromised mean? www.cdc.gov. That is right. That is the CDC's website. All right, here we go, guys. In 3, 2, and 1. B, a person whose immune system is weakened or not working properly. Immunocompromised patients are at higher risk for infections and may require reverse isolation to protect them from communicable diseases. So great job there. And then, we learned about the reverse isolation earlier. So good job applying them. Question 46. What is the CNA's responsibility if they are sick with a contagious illness? A, wear a mask and go to work. B, work in isolation. C, only care for healthy residents. Or D, stay home and notify their supervisor. My friend had a kidney transplant. Mila, I'm glad that she was able to get the transplant, but yes, her immune system is very compromised right now. And I'm sorry to hear that she had to get it, but I'm glad that she was able to get that. All right, you guys, here we go in 3, 2, and 1. The correct answer is D, stay home and notify the supervisor. So to protect others, ill healthcare workers should not work. So we want to make sure that we're staying home whenever we're ill. You want to notify your supervisor so that they can know that you're ill as well, and then staying home so that you can get better. All right. Now, question 47. Why do patients often shiver when they develop a fever? A, the muscles are working to raise the body's internal temperature. B, the body is reacting to dehydration. C, the body is trying to cool itself down. Or D, the patient is having a seizure. So why are they shivering when they have a fever? A few seconds here. 3, 2, and 1. Correct answer is A. The muscles are working to raise the body's internal temperature. So shivering occurs when the body's set point temperature increases due to infection or inflammation. The body responds by causing muscle contractions or shivering to generate heat and raise the core temperature to match the new set point. This part of the body's natural defense to fight off infection. CNAs should monitor the temperatures closely and report chills or shivering, as they may be a sign that the fever is rising. You guys, isn't it so unique how the body just works, that this is a natural defense to fight off infection? I think that's pretty cool. All right, 48. Are sexually transmitted diseases, or STDs, considered communicable diseases? And if so, why? A, no, because they are not spread through the air. B, yes, because they are spread from person to person through sexual contact and bodily fluids. C, no, because they only affect the reproductive system. Or D, yes, but only if the person has symptoms. What do we think about that? Is it a communicable disease or no? So this is the part where you will reflect back. What is the definition of a communicable disease? Here we go in 3, 2, and 1. Yes, because the correct answer was B, because they are spread from person to person through sexual contact and bodily fluids. So STDs are communicable diseases because they are caused by bacteria, viruses, or parasites that can be transmitted from one person to another, usually through sexual activity, blood, or other bodily fluids. Even if someone doesn't have visible symptoms, they can still spread the infection. CNAs must follow standard precautions to prevent exposure and help identify signs that need to be reported to the nurse. Nurse Eunice says she's so proud of you all, and I am too. You guys are doing great. I'm very proud of you guys. You guys are very smart. You guys are tuning in, which we really appreciate. And thank you guys so much for coming back. I thought I had lost you for a minute, but we were able to regroup. So thank you so much for coming back. And sorry again for the technical difficulties. We have a few more questions here, though, so hang tight with me. All right, 49. What precautions should a CNA take when caring for a resident with pink eye or conjunctivitis? A, airborne precautions. B, wear gloves and goggles. C, wear gloves and avoid touching eyes. Or D, no PPE needed. So pink eye, patient has pink eye. What are you wearing? Getting quite a bit of feedback in the chat here. Give you guys 3 more seconds here. And 3, 2, and 1. The correct answer is C, wear gloves and avoid touching your eyes. So conjunctivitis spreads through contact, and gloves prevent transfer. Hand washing before and after glove use is also essential. While goggles or face shields are not required under normal circumstances, CNA should avoid touching their face or eyes during care and should always report new or worsening symptoms to the nurse. So it's very contagious, so make sure that you're wearing your proper PPE with them. Question 50. When caring for a resident with hepatitis A, the CNA should be especially careful about A, toileting hygiene, B, coughing, C, loud noise, or D, ambulation. All right, here we go in 3, 2, and 1. Correct answer is A, toileting hygiene. Hepatitis A spreads via fecal oral route, making toileting a key focus for infection prevention. Someone says, let's see. T, loyalty. Hi, everyone. I'm late. T, thank you for still showing up. You can watch the full video on YouTube if you just click on this link. after it's over, which we're almost wrapping up here. It'll be on there so you can go ahead and watch that again and practice these test questions. All right. Let's see. So again, thank you guys so much for watching. You should follow us at Florida Training and also follow Nurse Eunice at Eunice Mathis. We have a CNA podcast. The website is www.youtube.com, and there's a slash at Florida Training, then another backslash podcast. So be sure to comment, like, share, and subscribe. And the CNA Exam Prep on the Go with Nurse Eunice and friends. So again, multiple resources here. Just make sure you guys are tuning in and checking it all out, because we are definitely setting you all up for success. And that is it for the night. So again, thank you guys so much. Again, I'm so glad that you guys came back. I really didn't think you guys would show back up. So thank you so much. You guys will do great. I hope everybody enjoys their evening, and take care. Nurse Eunice will also be on this week, so be sure to tune in. And I will see you all next Monday around 6:30 p.m. Tyler says hi, Mommy. Hi, Tyler. Hi, Nala. All right, you guys, take care, and thank you again, and have a great evening. And also want you guys to know that this was a learning experience for me as well. I had my notepad and my pen taking notes for myself. So see you guys, and have a good night.